Good afternoon, Dr. Sharma. Welcome, sir, once again to another session on mental health.
Good afternoon, Dr. Vasconcelos. Good to be back with you.
Doc, today is July 7th, 2020. The year is going by fast, and during this COVID-19, we hear a lot about justice. Can you explain to our audience a little bit about the medical model of justice?
Sure. So when we look at the ethical principles that we apply to medicine and medical practice, justice is one of those. We have the others called it autonomy and non-maleficence and beneficence, but we have justice, which is a big one, which we use when we determine what's in the best interest of our patients. But we can apply that to also persons in our society during this COVID crisis, because a lot of people are affected very negatively. We talked before about autonomy and the right for self-determination, but we also have to look at the rights of the people around us in society versus our own individual choices. So sometimes we may not feel quite happy about decisions that are made for us when we are accustomed to making those decisions for ourselves, but the best interest of people always outweighs our self-interest. And that's also true for justice, because justice, generally, we think of it as the practice of the law, and we govern by laws and rules. But when it comes to medical justice, it's a little bit more unclear in the sense that we're not always guided by a strict law. It's more of a principle of fairness. What's in the best interest of a person to themselves may not seem fair when an alternative choice is determined. So people have to have a lot of patience and a lot of understanding with compassion and empathy to appreciate that decisions that are made along the medical lines of justice are the correct ones. I'll give you an example, Doc. For example, if we look at this time of the COVID crisis, and we are in a country where there are a large number of people, but the vaccine is found against the COVID virus. But there are not enough people to get it. So we have to select now who should receive the vaccines. And say we have 1 million persons and the vaccines come to the physicians at the community clinic. They got to determine who's priority. And so there are children waiting, the elderly waiting, politicians are waiting, all important people are waiting. Now, who do you think should get that first vaccine? And that's a very interesting question when I ask that of my medical students in class. Who do you think should have the first vaccine in any situation where a vaccine is needed? What do you think, Doc?
You know, that's a good question, Doc, because that's being dealt with right now with the emergency rooms. You may have 10 patients that need a particular treatment, and you only have 3. And I guess it's in your hands, the medical doctor, to figure out exactly who should get priority and what index is used to determine which is the person really who deserves that treatment. And it's a very high ethical question, and I prefer you to answer it, Doc.
I'll answer it. So it's quite a surprising answer. It's actually the doctor who should get the vaccine first. Because, if we lose that doctor, then nobody's going to get it. So the health team actually would have priority. So it just gives you an example of how difficult that decision can be for persons out there when you have children who need it. Our hearts will go out to those children who may contract the virus because they're not getting the vaccines. But it's a very, very tough time, and tough time call for tough decisions. So it's like in a plane, we always say the moms and the parents have to put on those oxygen masks if they fall. Because while you may be sympathetic to the child and you start to put the oxygen mask on the child, your breathing may be affected in the negative way. So it's common sense laws. It's more in terms of fairness and what is important for life. So, we got to weigh those decisions. And as you rightly said, it's the doctors who really must decide, along with leaders and administrators and so on. So, a team approach. So, the way to go is by a team approach to make that determination.
Great, Doc. And in the context, regardless whether it's the US, Guyana, or another country, what can be done for best application in this context?
So to build on that point I was making, that the team must be the decider, we should see that that is already in place in many countries where the COVID task forces should be led by the medical experts. And that's true because, many of our decisions now worldwide are being led by evidence from the WHO and from the CDC and so on. But within the individual countries, it cannot be one individual. A politician himself can't take that decision where you're looking at application of the principle of justice. And if you look at, for example, decisions about curfews and the forced wearing of masks, those also have to be guided by public opinion. And even when public opinion may not be fully with the group that makes a decision, there must be every effort should be made to have a collaboration of persons. So any country that practices a situation where one set of individuals are sitting in determination of the rights of others, it's not right. It's not right that others in the society are not included, that information are not clearly given to the public as to why a decision was made. For example, there are strange decisions where at a certain time of the day, the country goes into a curfew. And what difference does it make? I can understand that persons may say that people come out and there's revelry in the nights and there should be control of those situations, and that's fine. But these reasons must be clearly given to the public. And any task force should have broad representation. We should have the best of the medical experts. And if, for example, a task force does not have that, or it's led by a politician, is deficient. So that's my personal view when it comes to application of fairness and justice of the laws, of public health laws. For example, here in Ghana, I think our public health laws are way back in time, they're antiquated. And are they applicable? Have they been advanced or modernized? We have too many laws here that are antiquated. I think the Mental Health Law Act is way back in somewhere like 1903 or something. So these things have to change. So be sure that we're doing the right for people. We must apply all the ethical principles that we've been talking about for people, because the rights of every individual is paramount. The safety of every individual is paramount. But we cannot use a broad brush to say, I'm applying safety principles, and in actual fact, what we're doing is abusing the rights of individuals. So there must be respect whilst we protect.
Absolutely, Doc. There's an old saying, I'm sure you're familiar with, prevention is better than cure. And so it's so important for people to not only use common sense, but when getting advice, to get it from competent people like yourself. It is amazing how you have doctors like yourself, scientists, competent people giving people advice, and yet they would turn around and listen to some of the most incompetent pathological liars. And that defense mechanism, as we go through this mental health process, Doc, is very complex. But we thank God we have people like you that can really help the average person. And any final thoughts, Doc?
Yes, so I'd like to people consider what we're talking about, that within our own communities that we start to apply the practice of common sense, but also that we're guided by collaboration and respect for each other and respect for the persons who have the capability. And we use these people. We must be cognizant that in every society there are people with the best knowledge, and we should apply and support those people to be part of important decision making. So that's my thoughts on that. And thank you again, Doc. It's always a joy to be with you and with our listening audience. I wish everybody safety. And I say, again, when it comes to a decision that's made for us, we may not particularly like it, but if we understand where it's coming from and why it is, we will accept it better. Human beings like to be involved in decision making, not to just to be told what to do.
Amen. Thank you so much, Doc. God bless you and keep you safe. And I look forward to seeing you soon in person.
All right, you take care.